Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Aline, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today. Now we'll ask our next expert speaker, who is a heart specialist, cardiologist, Dr. Tarun Sharma. I'll invite him, who has been practicing in Surrey.
Now, Dr. Sharma will tell us in detail about the structure of the heart and the heart rhythm. Okay, thank you everyone. It's good that we all exercised. Now we all are out of our sleep, and now the exercise we have just done now. This is very important for the patients. We can do it anywhere, anytime. So and it's very good for your health. So the exercise is very important. Now I'll talk to you about heart rhythm and some other issues that Dr. Sangeda explained to you earlier. I'll tell it in more detail. So, what are the other matters that can affect your heart? Yeah, issues about the heart rhythm. What can ruin your health? The other issues that can impact. There are questions that I told you earlier, and there are other questions that I'll talk about. First of all, the question is what issues can affect your heart? What are the other illnesses that can affect your heart? How it affects the blood supply? We already talked about that. I will tell you about this. How our heart normally beats because of it. It beats because of the electric signal. There is a signal that's produced in the top, and then it reaches to the bottom. As Dr. Sagera told you earlier, there are four parts of the heart. There are two up and two at the bottom. The bottom part of the right side, their function is to send blood to the lungs, and the function of the left part is function is to provide blood supply to the whole body. So then blood goes to the lungs, back to here, and then that's how the blood flows in your body. Because heart contracts because of the signal, the electric signal. The same signal goes right and left and then goes to the bottom of the heart. When you go to the hospital or the doctor, they tell us to do ECG. They get it done. They put the stickers on the chest, the wires, and then they check this signal. So the signal looks like this. This long line, it means your the small line is related to the upper part and the long line is to the bottom part. That means there is no fault in this one. If there is a defect in the signal in the bottom or in the center, then you will get irregular heartbeat. If there is a problem with the electric current, when it goes up and down, it's called arrhythmia. The rhythm of the electric current is not proper. What happens is then, when the signals go like this, is called arrhythmia. The upper signal is making up, but then it stops. It doesn't reach to the bottom of the heart. That's why the heartbeat is slower than the normal. Sometimes it's possible the upper signal is very much present. When the heartbeat is very small, it means very slow, it means the signal is not going down to the bottom. Then you feel dizziness, shortness of breath, people faint. Sometimes, if the signal is too much, excessive, all of a sudden there are too many signals, then you feel palpitations. If the signal is too fast, patients will feel palpitations. Yeah, the doctor will refer it to as palpitation. And then, like arrhythmia is like electric current. when there is a problem with the electric current, the most people face is called atrial fibrillation. What happens in atrial fibrillation, as Dr. Sugira told, the top part gets a signal and it suppresses it there. The upper part is not getting pressed properly. Is Then what happens before because of that? Then it's not the problem with the blood vessels, it's a problem within the heart, because the plaque starts getting deposited in the heart muscle. It's so the blood that's thickened there, then it becomes a clot, and then it causes a stroke. And once that clot reaches to the brain, it causes stroke. Then people can't speak. There is a problem with the mobility. The hands and legs don't work. If the clot travels and it travels through the stroke, there is a problem. It happens because of the electric current. When it happens to the patients, then the risk of stroke is more. So then we start them on the blood thinner to reduce the risk. The blood thinner, it's different than putting a stent in. The blood thinner medication is different than the stent. If there is a clot with the blood thinner, the risk of forming the clot is 70% less. That's one thing. First thing. Some people say, when I have a irregular heartbeat, I don't feel well because I feel it's fast or slow. Then we try to fix it. We call it irregular. Some of my patients will know cardioversion. It's called cardioversion. What it is, when we call you in the hospital, we attach a pad to the chest and then we give the electric shock. When we give the electric shock, it's like restarting, putting it off and then putting it on. So it's like restarting. Then the chances are the irregular arrhythmia will be cured like that with this cardioversion. Some For some people, uh, we can't even fix it with the shot because your arrhythmia is gone out of the shape. But we we can also give a medication to control this arrhythmia. Atrial fibrillation is very common illness, so there is a medication to fix it. There is another illness called heart block. What happens in this? As Dr. Sugira told you, the electricity doesn't travel to bottom part of the heart. It stops in the middle of the heart, and the heart is not pumping properly. It's not getting pressed properly. If there is a problem like this, we will admit you in the hospital because the electric current is not working properly. Then we insert a pacemaker. This is pacemaker. What is pacemaker? There is a wire attached to a instrument, and it will fix your the electric current in your heart. It will stimulate the signals. Symptoms of heart rhythm, like I told you earlier, shortness of breath. If the heart rate is slow, people faint. If it's fast, then palpitations. and sometimes pain in the chest as well. These are the symptoms of irregular arrhythmia. What can actually affect your rhythm? Heart attack could be one of them. If the high blood pressure for a long time, if you are using excessive alcohol, it could be possible because of that. Aging as well, as you grow old, it could affect your heart rhythm. So thyroid problem can also affect it. So if thyroid is up, then it can affect the heart. As I told you earlier, there are chances of stroke. You can faint with atrial fibrillation, weakened heart function as well. If there is a problem for a long time with your heart rhythm, you can get a cardiac arrest. It's different than heart attack. It's different. As you see it on the TV show, people are pressing on your heart. That's when the heart stops. Absolutely, is called. We already talked about atrial fibrillation. I will talk about heart valve problem. I will tell you in simple words. The blue blood is which there is no oxygen or less oxygen. You can see it's like a door. The valves are like a door. The the function is open and close so that the blood can flow in one direction. These are the doors of the heart, opening and closing their function. If there will be problem if it doesn't open. If it opens too much, there is a problem. Sometimes people faint because of that, shortness of breath, swelling in legs because of that, and weakening of heart. These are the problems faced if there is a problem with the heart valve. Then for that we do the ultrasound of the heart to test that if there is a problem with the heart valve. So they will do your ultrasound from all different parts of the heart. Some common questions that we face: people think, "Oh, my surgery is done, all the blockage is gone," but we don't remove those blocked arteries. So still you have to take care of your health. Nobody installed a stent because the blockage was only 40%. Then it shouldn't be installed. If the blockage is more, the rule is if the blockage is more than 70%, then you insert a stent. When we test is not that accurate if it could tell the difference between 60 to 70%. As far as the testing is not showing 70% blockage, then we don't install the stent. So we don't put the stent in. The blockage shouldn't be up to 0%. If there is less than 70%, then you can take the medication and stabilize it. That's very important. The next question I usually face is putting stent is the only way to fix the blockage. Uh, First of all, I want to tell you exercise is very important. It decreases the risk of the heart disease, and taking medication is very important. Stent and bypass surgery is not enough. Exercise is very important. Taking medication are very important. Sometimes people think the need to take medication only for a short time. The surgery is done, the stent is done, so no need to take medication. No. As I told you earlier, the stent we have put in, they will open the blockage, but the medication is still important to keep it flowing. People say, I have a smart watch and it tells me the heart rate is low. No, we can't go like that. When people are sleeping, everybody's heart rate goes slow. It doesn't mean you need a pacemaker. You talk to your family doctor. He will talk to us, and then we will decide if you really need a pacemaker. The main things I will tell you again, there could be problem because of heart valves, and then the electric current. If there is a defect in that, we fix it in different ways. So even if there is a surgery or stent, or if there is no surgery, no stent, you you control your risk factor, and then you can reduce your heart uh, um, disease. uh, Quit smoking, don't drink too much, and do the regular exercise. Thank you.
As I said, there are many questions. I'll name the speaker, then I'll ask the question. But if anybody else want to say anything, add to it, they can do that. First question from Dr. Sharma. What's the difference between a stunt and pacemaker? Pacemaker, can both be put in one person? As I talked earlier, we use a stunt for different conditions, and then we can put a pacemaker for different condition. If somebody had a heart attack, then stunt is usually done, and otherwise, it is possible to put both. Next question is, just add to that, stunt are put in the blood vessels. Pacemaker is a unit outside with the wire connecting to the heart into a vessel. Next question is for Dr. Sangira. There are many questions about this topic. Stress. How does that affect our heart? How does stress affect our heart? The stress we're talking about, it affects the whole body. We don't pay much attention to mental illness. We don't want to talk among our family about these things. All the mental problems we have, it increases your heart problems, your diabetes, your nerves get tightened. So it affects your heart disease. We should all try all our religions, either you follow Sikhism or read Bible or Quran, they are all reminding us over and over again to reduce the stress. If you win your heart, you can win the world. Reduce worry and stress. It's better to reduce it, control it. It's better for better health for whole body. Next question is for Dr. Sharma. There are many questions about cholesterol. Everybody's asking, if my cholesterol is normal, that means it's not high, do I still need to take medication for it? The doctor, Singera, talked about it. The people say, if I've been put on medication, the cholesterol level that we target, it's our attempt to keep it below that target. If it is below 1.8, then we try to be as aggressive to reduce it. So the main point is, somebody says, my cholesterol is fine. For every person, it's different. It's based on your health. If the level is fine, if a person had a heart attack, that beside cholesterol, there are other issues that we need to control. If there is a swelling, inflammation, then it's effective for that person to reduce the cholesterol medication. And when people are much older, when they're 80, 90, and they think about, the cholesterol that we have now, that you had taken it for the whole life, you reduce the risk of stroke and heart attack. Then you try to reduce the medication. But when you have heart problem, you need to take it. Yes, Dr. Segura? The cholesterol repair hypothesis, as we were looking at the blockage earlier, the theory that came out that it's due to cholesterol, the research you're talking about, that we did some research, fine, we gave some medication for cholesterol, that it will reduce the risk of heart attack. But cholesterol is not the only reason for heart attack. But if you don't control everything, that doesn't mean if you control one thing. If you reduce your cholesterol even 1 millimole, the research is there. What you're talking about here, sometimes people look at YouTube videos or heart attack, then the doctors say cholesterol has reduced. Then they're getting wrong information. But the complete information is there are other things, with cholesterol that you need to control, that you should control as well. Uncle, let me answer your question right away. What we are listening since this morning, there are many reasons. There are many causes that increase your risk. But then you're not paying attention to the others, you're just paying attention to the cholesterol. You need to pay attention to everything. If you're talking about online media, sometimes it's very minor. They make it such a big fuss about it. And Dr. Sharma and others explained, if you have high blood pressure and you're not able to control it, and then you think there's no need to control your cholesterol, but if you bring it together, you should try to do it all that. What should be cholesterol level? If I look at it, I send somebody for a test. They take the test paper, they control it for a month, and then they get the testing done. They'll see if it is fine, and then they start doing it what they were doing earlier. And then they say, my cholesterol was normal, you didn't fix it. How did I get a heart attack? You need to have the cholesterol in check every day. It should be fine. Your sugar levels, the medication that we provide to you, it affects your body for 8 hours, 12 hours, 24 hours. If it is for 12 hours, then it's given twice a day. If it is for fact is for 24 hours, then you take it once a day. If you take it once a day, then 2-3 days you don't take it. It doesn't have that same effect. If we are telling you that it's to control, then you need to take it every day. To control your body, your illness, if you control it, then you won't face any problems in the future. If you don't control it, the problems are going to get bigger and bigger. And if you take half, and if you keep adding it, if you work as a team, you assist each other, then that can really help you in the long run. Let me ask all the questions. If we have some time later on, then we can ask those later. Next question is for Dr. Singera about blood pressure. There are many questions. They're all similar questions. So I'll just ask one or two. If you have blood pressure going up once or twice a week, then is that hypertension? If we're checking at home, how many times should we check it? How should we check it? Morning or evening? What time? And what is hypertension? So, first of all, the blood pressure numbers are, if they have no other problem or illness, and there are two numbers. One is 140 and 90. It's below that. It should be below that. If you don't have any other problems or disease. If you have diabetes and if you have heart problems or heart illness or disease, then it's tightened a little bit. As Dr. Sharma explained, if somebody has diabetes, then the bad cholesterol, it's 2.0, the target range is. But if you have that illness or disease, then it should be 1.8. Same thing with the blood pressure. If you have any other problems, then 130, it should be below 130/80. And the rest of the things, when should we check it? Try, if you don't have any worries or tension, that's fine. But if you're worried about it, then you get it checked. The more you check it, more worried you'll get it. So reduce that worry as well. You should check it according to your body, how it's reacting, and what else is happening in your life. Do it according to that. And if husband and wife are fighting with each other, then checking the blood pressure. And in the morning you get up, your body is relaxed, and your blood pressure might be normal. So those are the things you need to do at different times. And you should look, how your body is reacting to it, how it is working with it. If we eat something very salty and then check it, it goes up. But don't take it too seriously, reduce the tension. Don't worry about, your blood pressure is going up. If you check it once a week, make an appointment with the doctor, talk to them, and tell them, this is fine at this time, it's going up at this time. And the teamwork is very important. That will help us. And they said, don't worry too much, reduce the worries. How can you do that?
The next question is for Gundeep. The other question is why we should do self-manage and what it is. Why should we self-manage if the doctors are taking care of us? Why should we do it? Self-management is very important. Our health is our responsibility. My health is my responsibility. My doctor prescribed the medication. It's my responsibility to take it on time. So who's going to affect it? Me. Whose health will be ruined? Mine. So take charge of your health. It's very important. We can only do this if we understand it. Because slowly, if we are healthy, so it's not important just to be healthy, but also prevent other illnesses for a long time. So if we start changing our lifestyle, it will be affecting our health, our family. When we are ill, it affects the family. Life gets disturbed, social life gets disturbed, and along with that, we burden the healthcare system. So there is already a big problem with the healthcare system, lot of problems. So self-management is very important. How you do it? Just a small beginning. So here we were sitting down, we exercised for 15 minutes. If we do exercise 15 minutes at home, it will affect a lot of things. blood pressure will be controlled, diabetes will be controlled if you make it a habit. So there will be a lot of benefit. Control your meals. If you are diabetic, it doesn't mean you cannot eat sweet at all. Maybe include it in your menu and your diet menu you have made. Make the adjustments. Even with having illness, how you can control, how you can manage. You That's what is taught in the self management. How you begin it. Sometimes they will do it, just they have problem with starting it. So it's your responsibility. There are programs available and it's free of charge. So maybe you are not aware of it when you can start it and how you start it. So know yourself, tell others, ask questions, ask about education classes, ask your family where we can benefit from. It's very important to self manage. Thank you. The next question is for Dr. Sharma. Dr. Sharma, after your session, we have lot of concerns. It's about the stress close to that. If somebody has stent or bypass, how long you can live? It won't reduce their life. The second question is, if stent or bypass, we take the artery from the leg, what will happen to the leg? It's a good question, right? Next question is, after the bypass surgery, there should be still pain present, or I'll still feel pain if I already have stents. So the first question was, people who have surgery or bypass or stent, how it affects life. First thing is, the surgery or stent is done because there was heart blockage. If once there is a heart blockage, the risk of heart attack is there. To decrease that, reduce that risk, we start medication. Bypass surgery or stent, we do it to improve chest pain or reduce heart attack. But if you don't control other things, other aspects, not controlling your sugar intake, cholesterol, then there will be a risk always. If you control all those things, and then your risk will be the same as the normal people. That's the answer to the first question. The second question is about the leg. When we take the vein from the leg, there are two kinds of blood vessels. There is a blood vessel that brings the blood to the body. The other blood vessels are that takes the blood back to the heart. That brings back the blood is vein. There is supply and connection is very good if we cut one, but the other veins are able to bring the blood back to the heart. There will be a cut on your leg, but when we take a longer vein, there will be a little bit of swelling on the leg. But you shouldn't worry about that. There is no need to fear that. The last question was life expectancy when the bypass surgery is done. Our main goal is your main heart related pain should be cured, and the heart attack risk we should reduce, and the risk will be reduced in the future. But it doesn't mean that your pain will be zero. Maybe there is still some blockages, but we created a new pathway for the blood flow. There could be still little bit pain after the bypass surgery. We call it stable angina. We wanted to reduce the load at the heart. We First of all, we reduce the chest pain with that. I showed you we open the chest, so we have to cut the bones. So it takes time for the bone to heal, sometimes up to a year. For some people, think that there is kind of pricking. That is because we open the surgery. We did the surgery by opening the chest, and there is bone that is still healing. There are lot of questions, and I'll be keep on asking about in a line. There are questions about the heart rate, resting heart rate. When you are not doing anything, that's what it means. When your heart rate is 50 to 62, when you start exercising or started running, and then it goes to 170, is it okay? The other question is around heart rate. If we check our heart rate, can we know if our pulse is irregular or is not regular? The first question is about heartbeat. How much it go up from the regular heartbeat? It depends on the age. How old are you? How healthy you are? It depends on that. Resting heart rate normally we look is around 55. Even if you are sleeping, 55 to 60 up to 65 is normal when you are sleeping, but when you are awake, sitting down, not working, not is normal 60 to 80. When we are exercising, it depends what kind of exercise we are doing. The formula is deduct your age from 220. So if you are doing regular exercise, it should be 80% of that if a normal person. So if a person is 60, so 220 minus 60 is 160. 130, 140 if you are exercising. If there is 20-25-year-old person and he is working hard, he is doing vigorous exercise, it's okay if it goes above 200. It depends on the health and the age of the person. Like Ajay made us to do exercise. If you do it every day, if you do work hard, then our tolerance, we can increase our tolerance. Don't let the mic go. There is one more question for you. If you have heart disease, what side is better to sleep on, right or left or straight on your back? This is specific for you. If you have heart disease, it doesn't matter. You can sleep on either side. My guidance is don't sleep on the stomach. That's normally told. Don't, if you sleep on your back, then your neck also should be supported. If you are sleeping on stomach, sometimes the neck is tilted on either side, then you can't go into the deep sleep. The heart disease doesn't affect what side you sleep. There are two more questions. One is for Gandeep, one is Dr. Sharma. We are going over the time. After that, Ripujit will bring some information for you. Is it okay, Dr. Sangira? Dr. Sharma told about the swelling on the leg. The advice is once your wounds are healed, we advise wear the stockings. There are special stockings, and then the inflammation and the swelling will go away slowly. Sometimes they use the stockings and then they stop using it. If you continuously wear pressure stockings, then it should be okay. Little bit problem is always there in the body. Thank you. You told. There is a specific question for you, Dr. Sharma. I hope I am reading correctly. So in Surrey Memorial, is there a coronary angiogram available instead of straight and coronary angiography? There is a one question in relation to that too. You recently heard that we had a campaign.
And we're still doing it. that we should have a cath lab in Surrey, that for stunts and all that. The patients who had stunts, if you came to Surrey Memorial, then we sent those people to Royal Columbian Hospital to put the stunts on. That's the campaign we did, that we should have it in Surrey Memorial Hospital, so people won't have to go anywhere else. They can do it in Surrey. We did the campaign for that. Where they put the stent, they call it cath lab, so that's a cardiac arrest lab. Now we're doing fundraising. Our committee has helped a lot. It's still ongoing. We are trying to have a cath lab here. So if you can build a cath lab here, that can help the patients. Somebody asked a question in that regard, how they can donate. Surrey Hospital Foundation, Surrey Memorial Hospital Foundation, if you go to their website, if you wish to donate, there are numbers there. You can call and talk to them. Then they can tell you how to donate. The second question is cath lab, CT angiogram. What's the difference? It's fine. The straight cath, we can do that procedure. You can go all the way to your thigh for the tube. If you, instead of going and doing that tube, how we can do it, it's done in Surrey Memorial. Once the CT scan, there's some waiting for that. If the wait list is more and we don't want to wait, we send for angiogram. But if you think the risk is not that high and we wish to check, but we have some time, then CD coronary angiogram is done in Surrey. Last question for Gandeep. They have campaigns. When you talk to them, you can specify which campaign you want to donate to. You have to. Thank you. I can find. Last question. Our time is done. We just have a couple minutes. For us in Panjabi, that if you have resources for self-management, for the resources in Panjabi, those are available on our website. If you go on that website and put your name down and program for diabetes and chronic disease, there's a program for 6 weeks. So with the chronic pain toolkit, that's available in Punjabi as well. And you can get the contact information from outside. You can email me directly as well. And we also have a toll-free number on website. You can talk to us. And on toll-free number, you can talk only in English. But my number, you can talk to me in Punjabi as well. That's up to you, how you wish to contact us. Thank you so much. Dr. Sharma, if you can answer in short, there are 3 arteries mainly. Then there's extra arteries called. Some people have 4, 5. I was just saying that. Stents. There are 3 main arteries. Some people have 4. They're called. There are 3 or 4 mainly for everybody. That's the first question. Said how many stunts? You can put more stunts, but our attempt is, if the 3 arteries are blocked, then we do the surgery. Then if one person had a 1 stunt on, a few years later put another one, and a few years later put another one, you can put more stunts. But we don't want to put so many stunts. We want to control the stunts. And the salt you're talking about, there's no such evidence that Himalayan salt or Pakistani salt is better for blood pressure. We're just saying mainly to reduce the salt intake. I wish to thank all our speakers, Dr. Sangera, Dr. Sharma, and Gandeep as well. And from now on, we sow a seed into everybody's mind about knowledge, and they're outside And there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us uh, sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event. And you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge. And I wish to thank them as well. BC Renal, City of Surrey, Diversity Options, PECs, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers. And I wish to thank them very much from bottom of my heart, Dr. Baldev Singera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Chima, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Indeep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Mays. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.